The Ontario government has revealed details of its controversial plan to ease the strain on the province's hospitals, which involves transferring patients waiting for a spot in long-term care to facilities that are not of their choosing. Megan Fitzpatrick is following this story, and she joins us now live. Good morning, Megan. We're learning a few more details about this policy. How's it expected to work?
Yeah, so Bill 7 was introduced in August, John, and it was passed very quickly here at the legislature. The Ford government fast-tracked it. There were no public hearings, and the bill itself didn't contain some key details. The government said that those would come later in regulations, and those regulations were released yesterday. As you mentioned, Bill 7 essentially means that a patient who is in a hospital and their doctors determine they can be discharged, and they're maybe waiting for a bed in a long-term care, their preferred long-term care home. What will happen now is a placement coordinator will find a bed for them somewhere else, essentially, while they wait for a bed in their number one choice home. And all of this can be done without the patient's consent. All these arrangements made without their consent. They won't physically be moved to a home without their consent. But what will happen if they do not accept a bed that is found for them, they will be charged what we are now learning is $400 a day. The distances, too, have now been dictated in these new regulations. So what the bill is now saying is that placement coordinator will look for a home up to 70 kilometres away for someone in southern Ontario, up to 150 kilometres away for someone in northern Ontario. And again, this fee that will be charged if they don't leave the hospital is $400 a day. Hospitals already had the ability to charge patients for staying in beds, and it was basically at their discretion whether to levy those charges or not. There had been concerns that hospitals would start charging patients up to $1,800 a day, but the government now is setting this flat fee of $400 a day that the hospitals will be required to charge. Health Minister Sylvia Jones and Long-Term Care Minister Paul Calandra both defended the legislation and the regulations yesterday. Here's some of the Long-Term Care Minister.
It's not $1,800 a day. It's not 1,000 kilometers away. It's not Northern Ontario going to Southern Ontario. It's close to home, close to the people that you love. It's a better quality of care, and it is a transformation of the system that the people of this province have been asking for. Our hospitals have been asking for. Our doctors have been asking for decades.
And these new regulations, John, take effect on September 21st, and on November 20th is when hospitals will start charging that fee.
Okay, Megan, what kind of reaction are we seeing to the new regulations?
Well, the opposition parties were quick to react yesterday, the NDP and the Liberals criticizing the government over this. They're saying it won't do much to actually help the crisis that hospitals are facing right now in terms of their emergency room pressures or the long wait list for people who need surgeries in Ontario. They say that's all about the staffing crisis and the government needs to address that, and that this bill will hurt more people than it helps. They call it heartbreaking that families might have to travel long distances to see their loved ones in a long-term care home that they don't want to be in. We will hear more reaction today, John. A group called the Ontario Health Coalition is holding a news conference later today where we can expect much more criticism of Bill 7.
Megan Fitzpatrick in Toronto, thank you.
You're welcome.